What is the status of the IMI joint undertaking? The IMI-GU is established under European law. It's a decision of the member states, it's a decision of the European Council. It's using one particular article of the Treaty on the Functioning of the EU, which allows the EU to take part in joint undertakings. But the important thing to mention is that the IMI-GU is an autonomous union body. IMI-GU is not Commission or not FPA. Both Commission and FPA are at the governing board with equal representativity, but IMI-GU is autonomous. Of course, it's a public body. It means also that it includes some principles of public accountability. This is also something important to mention. So what is the complementarity with the other FP7 activities? I've shown to you before some of these precise different tools that could address the different needs of European research. What is the complementarity that IMI can offer to these other tools? What IMI can offer is to support research which is expected to generate pre-competitive research tools. And this is important because this can be injected in the drug development process in order to make drug development safer, more efficient for the benefit of the patient. The other thing which is unique to IMI-GU is a specific research approach which is based on a very broad and unique partnership. There is no single other consortium supported by the European research where you can find such an amount of pharma companies working together with academics, with SMEs, with patient organization, and with small and medium enterprise, and even sometimes with regulatory. This is something unique that we should use to the best, because this is something that cannot be found at other places. The important thing that you should remind is that IMI-GU is not there just to support research for the purpose of supporting research. It's not just another funding sources. If you participate to IMI, it's for precise purposes. It should address precise industry needs. It should address precise challenges behind the drug development process. What are the challenges that we see? It's of course obvious that we face here a typical problem-solving approach. As I mentioned, it's not research for the purpose of research. We expect open innovation to be one of the main drivers of this initiative, and we need to have discoveries that will help to unlock some precise disease area where we have clear unmet medical needs. Of course, all these new research tools that will be discovered by these research projects must be rapidly taken up in the pipeline of the research development. There's something very important. They should not be kept within each consortium and kept secret or whatever you can imagine. They must be injected rapidly into the drug development process. It's obvious that all along IMI-GU there will be a specific need for dialogue with the regulatory authorities. It's also clear that IMI is accepting to work beyond usual habits. As I mentioned, it's not easy to have all these partners working together. It will involve a change of behavior, being seen from competitors towards participants and partnership, and this will clearly involve trust between partners. Academics and SMEs should not be seen by industry as subcontractors. And on the other side, academics and SMEs must be ready to work with big pharma. This is only with this basis that such project can work. What is the expectation of the EU in terms of public-private partnerships? And in particular, what do we expect with the IMI-GU? What is our hope after 3, 4, 5, or 6 years of support of the IMI-GU? Our hope at the scientific point of view is indeed to have new pre-competitive research tools that will help to modernize the drug development process for the benefit of the patient. This is, of course, the most important thing. That's the most important scientific challenge. Beyond that, we hope to be able to see the creation of a critical mass, critical networks. For an academic, it must be very important to be able to consolidate at long term a collaboration with private partner. For SMEs, it may be very important to be able to have new marketing possibilities by taking part to an IMI project. And beyond that, we must be able to reinforce investments and competitiveness in the European pharmaceutical sector. This is what we aim for with IMI-GU. I would like to mention this is not a unique public-private partnership that we are supporting. We also support PPPs in aeronautics. We also support PPPs in the energy area, always with the same thinking behind. We also see a future with PPPs. We don't see this as just one shot. And I would like to mention that in November 2009, the Commission has made a communication on the future of the public-private partnership, where it is very enthusiastic with this type of approach and where it is ready to sustain them and to support them at longer term. Thank you very much for your attention, and I stay open for any question.